Dr. Kostovich is an associate professor in the School of Nursing at Loyola, and she also serves as the assistant dean for innovative educational strategies and simulation. In this role, she oversees nursing simulation and lab activities provided at the school's three locations and across all different programs. So with that, I'd like to go ahead and welcome Dr. Kostovich. Thank you.
So thank you for the opportunity to speak on something that I'm really passionate about. And I think it fits in well with what Dr. Houston just shared with us. So I'm going to talk to you about being present, preserving the nurse-patient connection in a world of monitors and megabytes. So in a world that here we are on Zoom, having a conference that normally would be in person. So I would first like to acknowledge that studies conducted at Edward Hines VA Hospital were funded by a grant from the United States Department of Veterans Affairs, a Nursing Research Initiative grant, and a Nursing Postdoctoral Fellowship. Now, the views expressed in this presentation are ours and do not necessarily reflect the position or policy of the Department of Veterans Affairs or the United States government. So Maya Angelou said, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." And really, in the context of nursing, this is nursing presence. So what are the theoretical underpinnings of nursing presence? So Patterson and Zadira developed their humanistic nursing theory, and they talked about the being with and doing for care provided by the nurse. And this is connectedness between the nurse and the patient. Benner, in her book From Novice to Expert, talks about presencing and associated this presencing with the expert nurse. So keep that in mind. We're going to come back to that in a little bit. Gardner talked about presence, nursing presence, as being an intervention. And other authors state that presence requires openness by both the nurse and the patient. And finally, Parsi speaks of true presence, that presence is an intentional encounter between nurse and patient. It doesn't happen by chance. So what is nursing presence? It's the intersubjective human connectedness shared between the nurse and the patient. It's manifested through compassionate concern, openness, and commitment to another, grounded in knowledge, direct and indirect physical availability, and empathetic attention. So how does this presence happen? Well, here's a model of nursing presence. And what's unique about this is the multidimensional wholeness and the fluid boundary that exists between the nurse and the patient. So nursing presence transcends temporal and spatial constraints. Nursing presence simultaneously exists in that multidimensionality of the affective, behavioral, cognitive, and spiritual domains. But how can a nurse be present when this is what a nurse's real world often looks like? So I have two stories to tell you about nursing presence. So here's my first story. When I was a nursing supervisor making rounds on a patient, his nurse came into the room, and she was there to perform her physical initial assessment. Well, she checked the IV bag and the IV site. She checked his Foley catheter, his abdominal dressing. She asked how he felt, asked him for a pain rating. And she did all this while checking the supplies, the technology, and the equipment in the room. But she never once looked him in the eye. And when she left, the patient said to me, I think she forgot there was a person connected to the tubes. And I've noticed that there is a difference in how nurses interact and connect with patients. And clearly, patients identify that as well. So I set out to measure this phenomenon of nursing presence. And I developed an instrument called the Presence of Nursing Scale, the PONS, and it measured patients' perceptions of the nurse's presence. There's 25 items, and it's a rating scale of 1 to 5, measuring levels of agreement from never to always. So it was tested with 330 hospitalized patients, and the PONS demonstrated evidence of reliability and validity. Now, when I was at Hines VA Hospital during my VA fellowship, I developed a companion instrument, which is the Presence of Nursing Scale, RN version. So this measures nurses' perceptions of their ability to be present to their patient. So initially it started out being 31 items that were derived from the literature and endorsed by content experts. And it reflected the nurse's perceived performance of the elements of presence with their patients. But what we found was a very high ceiling effect. So what was happening is that the nurses were consistently rating themselves as very high in performing these nursing presence behaviors. And we thought, well, there was hardly any variability. And we wondered why, and we thought, well, maybe it's because nurses feel they have to answer this way because it was expected. It was part of their job as a nurse. So we revised the instrument and we added a time element. So the response options now said, I never seem to have time to do this, or I always made time to do this. So now we changed the response options to a Likert type scale of four option Likert type scale. And we assessed the psychometric properties of this revised version using Roche methodology. And what we found is that there were 2 subscales, the being with subscale that had 12 items and the doing for subscale, which had 30 items. So now here is my second story. This is the story of Melissa, and Melissa's not her real name. Melissa was one of my nursing students several years ago, and we were on an acute care unit of a local hospital. And I gave Melissa her patient assignment for the day. So we met in the morning, pre-conference, students get their assignments. I told her that the patient was a homeless gentleman who had just been diagnosed with lung cancer. But the patient has denied to the staff that he has cancer. He keeps telling the staff he has an infection. So about 15 minutes after the students left pre-conference to take care of their patients, Melissa came to find me and said, Dr. Kostovich, can I have a different patient assignment? I said, well, Melissa, why? She said, well, my patient doesn't want to talk to me and he doesn't really want me to take care of him. And well, he's sort of scruffy. So I told Melissa, well, it doesn't matter if he's scruffy. All patients deserve care. So let's go talk to your patient, Melissa. So I took Melissa back into his room and I said to the patient, hi, Mr. Smith, my name is Carol and I'm the nursing instructor on the unit today. And this is my student, Melissa. And today is your lucky day because you have 3 people to take care of you. You have your regular nurse, Mary, and you have me, and you have Melissa, and Melissa is my best student. So I'm going to let Melissa take care of you now, and if you need anything, you just give me a call. So I left Melissa with her patient, and I got busy with the other students passing meds. And by the time I finished passing all of the meds, it was almost 11 a.m. and I realized I hadn't seen Melissa in a while. And at that moment, I saw Melissa walking down the hall towards me, and she had tears in her eyes. And I thought, oh no, what happened? So I walked up to Melissa and I asked her if she was okay. And she said, Dr. Kostovich, thank you for making me take care of Mr. Schmidt. After you left, he started talking to me. He told me he had cancer. He said he never said those words out loud before, and he has never told anyone except me. He said he will always remember me. And you know what? I will always remember him. Now, me, as the nursing instructor, I have never forgotten that day in clinical. And to me, it's a perfect example of how powerful nursing presence can be. So I never forgot Melissa. And I kept thinking about Benner, who kept saying that only the expert nurse could be present to their patients. So I wanted to know more about students. So my colleague, Jeannie Vandeneck, and I both taught the first level med-surg course to our BSN students here at Loyola. And Jeannie shared my passion for nursing presence. And that led us to conduct a study exploring pre-licensure nursing students' perceptions of presence during their first clinical rotation, their med-surg rotation. Now, we formally taught the students on the first day of theory class about nursing presence. And on the last day of theory class, we gave them a one-page survey that just had one question on it. And it said, tell us about a time that you were present to your patients in clinical this semester. And to my dismay, students were writing and writing and writing and writing. I thought they'd write maybe one line, but some of them wrote a couple pages. And we had 32 students respond, and we used Tedley and Toporski's quantitizing narrative data method to analyze the data. And we found 106 examples of nursing presence that were identified by these students. And all 12 items of the beingness subscale of the PANS-RN were represented. So here's some examples of what the students said in alignment with the PANS-RN item. So students talked about meeting the spiritual needs of the patient. They talked about praying with their patients. They talked about emotionally comforting the patients. One student said, I sat with her and I just talked to her and watched The Price is Right. She couldn't talk to me, but I could tell that just sitting with her made her happy. Students talked about sharing their own feelings with the patients. A student said he was 95 years old and he told me he didn't want to die in the hospital bed, at which point I started crying as well. Students talked about non-health related topics with their patients. They talked about singing at the bedside with their patients. And the students talked about listening attentively to what the patient was saying. And a student said, you know, at first I was nervous because I felt like I had to say something. But then I remembered back to simulation and thought about the power of listening. And I felt special that someone would trust me with so much information. So not only were these students present to their patients, they were able to recognize it and they could label it as being present. Sorry. Oh, there we go. So following that study, a couple years later, a new faculty, Patty Bachmeyer, joined our med-surg team in the first course. And Jeannie and I talked to her about nursing presence. And Patty totally agreed with us and was on board. And we talked a lot about nursing presence, and we questioned whether students' perceived ability to be present to their patients over the course of their pre-licensure education actually changed. So we taught them about presence in their first course, and by the end of that first course, they could identify being present, but did they continue and carry that out in clinical through the rest of their curriculum? And so what we did was ask the students to complete the PONS RN at the beginning of their first clinical experience in med-surg. And we asked them to complete it again at the end of their last med-surg clinical, which was in their final semester of the program. And 80 students responded. We had both 4-year and accelerated BSN students, and we found a statistically significant increase in perceived ability to be present to their patients from the first med-surg course to the last med-surg course. So we have also integrated, as one of our students said in the qualitative data, the phenomenon of nursing presence into simulation. So we wondered if students would be able to pick up cues in simulation related to being present to their patients. So we modified 3 simulation scripts, 3 simulation scenarios in that first med-surg related simulation, and we included voice prompts and cues signaling to the student that there was an opportunity to be present to the patient. And we watched the recordings. There were 27 video recorded simulations, and we reviewed these recordings. It ended up being 13 and a half hours of video. And again, we used the quantizing qualitative data approach for analysis. And we recorded every time that a student picked up on a cue. And what we identified was all 12 items of the being with subscale were represented, that they were able, through simulation, to pick up on these cues. So we continue to teach nursing presence in high fidelity simulation. We have introduced an academic electronic health record in our simulations, and this is another opportunity to teach our students about presence. So where do you stand in the room when you have this big computer on wheels? Make sure that your patient can see you. They need to be looking at you, the person, the nurse, not the back of the computer. We are in the process of integrating telehealth simulations into our undergraduate clinical courses. And we have also integrated nursing presence and how are you present to your patient through a telehealth encounter. So we're trying to get the students to not lose that caring and personal touch, even though technology is being used. So the final study I'm going to talk about is a study that was conducted at Hines VA Hospital, and this study was supported by the Nursing Research Initiative grant, and it was investigating being present to patients and helping to facilitate patient-centered care. So what we know is that being present requires a mindful and focused attention on the patient. But there's many challenges to being present when you're in a clinical environment. So the nurses are exhausted, and we've seen this with COVID, right? They're stressed out, they're burned out. And then there's all these technological distractions on top of everything else. So there's pumps beeping, there's monitors flashing, there's cell phones ringing. Everything is competing for the nurse's attention. So how can the nurse be present to the patient? how can the nurse overcome these challenges? So we conducted a pilot study using a stress reduction strategy called the Mantra Repetition Program, or the MRP. And the MRP is a mind-body spiritual approach to stress management. It's a pause button for the mind. And the beauty of it is it can be practiced anywhere. It's portable. So it can be practiced anywhere and at any time. So for the mantra repetition program, the participants self-select a word or a phrase that has meaning for them. So usually they pick a word or a phrase that has a spiritual meaning, and we ask them to repeat it silently throughout the day. And the point is to train their attention and redirect the participants' unwanted thoughts. We try to have them use this mantra to elicit a relaxation response. We want them to repeat it throughout the day so it becomes a habit. So in doing so, the thinking process slows down and they can pause. They can be mindful and attentive in that present moment. Now, another component of the MRP is one-pointed attention, and that means doing one thing at a time, and that supports being present in the moment. So participants are taught the value of monotasking rather than multitasking, and we know nurses are very good at multitasking. So the whole point is to slow down, and it's a tool to help the nurses slow down and be present for their patients. So we used a pre-test, post-test, one group design method, and our intervention was 6 sessions of the mantra repetition program, and this was for nurses. It was the nurses who participated in this. 4 of these sessions were online self-paced learning modules, and 2 sessions were live sessions with a national expert in mantra. Now, we measured nurse variables and patient variables. So the nurse variables that we measured were professional quality of life, nursing presence, mindfulness, and existential well-being. Now, we measured patient variables. We measured patients' perceived presence in presence when they were cared for by the nurse who participated in the mantra program. And we also measured satisfaction with their overall nursing care. Now, we measured these variables at 3 points in time for the nurses. We measured before they participated in the mantra, immediately after their training, and then 2 months after the completion of their training. And then for the patients, we measured the nursing presence and satisfaction with nursing care 2 months after the nurses completed their mantra, so they would have time to practice that. So what did we find? Well, first I need to share that we conducted a power analysis that indicated our target sample size should be 23. And initially we recruited 35 participants, but only 15 completed the study. And they said that was because of too much time involved in completing the online modules. They had some technology difficulties accessing the modules, and many of them worked 12-hour shifts and were too tired to participate. But this slide shows that 2 months after the mantra training, almost 80% of the participants were still using their mantra training at work. Now, for the nurses, we looked at pre and post intervention comparisons. And what we found was a statistically significant increase in mindfulness and compassion satisfaction scores from pre to post intervention. Now, we also looked at nursing presence and spiritual well-being pre and post intervention. So we found a statistically significant increase in the PEACE scores from pre to post intervention. Now, related to nursing presence, we showed a non-statistically significant increase in both the being with and the doing for subscales pre to post intervention. And we do see in looking at the results that there is in the being with subscale a trend toward significance. But we need to keep in mind that our study was underpowered. We only had 15 participants in the sample. So perhaps with a larger sample, we would see statistically significant changes pre to post. Now with our patient findings, we identified that the patients perceived very high levels of nursing presence. So the patients completed the PONS scale, and so that's 24 items with a possible range of below 24 to the highest possible level of presence is 120. And you see that these patients identified very high levels of nursing presence. Their mean score was 109. Now, to measure satisfaction with nursing care, we use the Schmidt Perceptions of Nursing Care scale, and that is includes 4 subscales. And we also found that the patients were highly satisfied with their overall nursing care. So the highest possible score on the nursing satisfaction, Schmidt Perceptions of Nursing Satisfaction instrument is 75. And you can see that these patients were highly satisfied with a mean score of 67. And we also found that there was a statistically significant relationship between the sum score of the PONS and all 4 subscales of the Schmidt Perceptions of Nursing Care. So what are our next steps? Well, we've demonstrated that nursing presence behaviors increased in our sample of students as they progress through the curriculum. But what happens when they graduate? Do they continue to practice these presence behaviors with their patients? So our plan is to conduct a longitudinal study of nursing presence as they transition into practice and see if they are still able, with all of those technological distractions and everything else competing for their time and attention, are they still able to be present? The other thing that we plan to do is look again at our nursing students, and we've demonstrated that teaching Mantram to nurses was an effective way to increase mindfulness and compassion satisfaction, spiritual well-being, and nursing presence in a sample of registered nurses. But the current literature states that students are stressed, just like nurses. So there was a study published in 2016 that indicated that BSN students were found to have significantly more stress, anxiety, sleep disturbances, and stress-related illnesses than the general university student body. So we asked, well, what tools could we give our students while they're still students in school to potentially decrease their stress and help them transition into practice and be present for their patients? So we're interested in combining the Mantram stress reduction strategy with a virtual simulation to teach presence behaviors to students. And we want to explore the relationship between this Mantram intervention, perceived stress, anxiety, and the ability to be present to their patients. And then we want to follow up again while they are in practice. So these are my references. I would like to thank you for your time and attention. And I'd be happy to answer any questions either now or feel free to email me.
Thank you so much, Dr. Kostovich. That was a really interesting presentation, and I look forward to your continued research in this area. It sounds like you have some really great ideas for how to continue this and move it forward. Dr. Connor, I believe there were some questions for Dr. Kostovich.
Yes, and actually I think this is partially answered by your next steps, but someone had asked if you have some suggestions on how to encourage nursing presence in students, as we're also seeing so much advancement in technology, knowledge, and complex patient diagnoses, and sometimes that's really what interferes with that or takes precedence for some students.
And I think that's a great question. I think it begins with teaching students about presence, about that intangible, that connection that they're able to make with their patients. And I think that once they learn about it, they're able to recognize it. They're able to recognize what it is. I didn't report this in the presentation, but we also asked students to reflect on their clinical experience, their first clinical experience, and reflect on observations of nurses that they were working with, observations of the nurse being present to their patient, and observations where the nurse wasn't present to the patients. And those students were able to identify both. So I think if we teach them about presence and the importance of it in providing holistic care and treating the whole patient, then I think they will be more in tune to that. And if we give them tools to help them be present, I think that hopefully will help them transition into practice.
Thank you. And I have one more. It's really a comment, and I think you may have also answered this, but it has been my perception as a practicing bedside nurse for 37 years that being present for my patients actually gives more meaning to my work, but also decreases my own stress. Has this been reflected in your students? And I think you've answered a little bit about that, but if you wanted to respond.
And that's so true. And thank you for that comment, because the literature talks about not only patients benefiting from the interaction between the nurse and the patient, but how beneficial it is to the nurses to be involved in a nursing presence interaction, and how rewarding it is for them. So it's a mutual benefit. It's a win-win for both the nurse and the patient.
Thank you.
Thank you.
Thank you again, Dr. Kostovich.